Hello everyone, good morning. I'm Jack. I hope you are doing well. If you lose your appetite, cannot concentrate in class, and have trouble sleeping at night, do you know what the mental problem is? The answer is depression.
Yeah, upside.
Depression, upside depression. And so today I will talk about depression in college and university student. Did you ever suffer from depression in college? If yes, please raise your hand. Or many people. According to the WHO reported, 350 million people in the world have suffered from depression. And 7% to 9% of college and university students in Canada have suffered from depression. So academic and employment depression, emotional pressure, genetics are three main reasons for depression in college and university students. First of all, okay, in addition to normal academic pressure, college students also need to get certificates for employment. Some also need to face the pressure of taking postgraduate exam. Due to all kinds of these depressions, college students can easily experience depression. Seriously, long-term depression can lead to suicide. According to the HB-CDP reported, 0.5% of them have attempted suicide. The fact is that academic pressure is mainly peer competition. This procedure include honors, scholarships, and degree certificates. Because some courses are more difficult, plus some students' learning method is very poor. So some students have poor learning method. The pace of learning is too fast, and the mental stress is prolonged. So students can develop a major depressive disorder. Furthermore, some students often stay up late, have irregular study time, get inadequate rest, is obviously prone to addiction. So the second reason for depression in college and university students is emotional problem. College students have also reached the age of love, so there will be all kinds of problems emotionally. Some students feel a sense of frustration in love because of love loss. Plus, some students have struggled with family disputes. For example, some students have emotionally disputes or family disputes, which lead them to stay alone in their room for a long time and cannot communicate with the outside world. Finally, the prevalence of people with a family history of depression or first-degree relatives with depression is very high and cannot be ignored. The probability of depression among relatives of patients with depression is 10 to 30 times higher than that of general population. The closer the blood relationship, the higher the probability of disease. According to HB-CDP report, the probability of the depression among relatives of patients with depression is 14% for first-degree relatives, 48% for second-degree relatives, 3.7% 6% for third degree relative. It's very high. And in conclusion, because college students have a certain level of education and a strong comprehensive ability, counseling is often recommended. If depression are more severe, such as strong suicidal thoughts or suicidal behaviors, it's certain that seriously affect their studies and social interaction. In this case, some medicine should be treated. Many transition students continue to depend on their families. Parental involvement in treatment is very important. The good news is many college students with depression have returned to normal through counseling and parental consent. Thank you.